Pharmacology, final exam, and VTNE review. Antibiotics. Penicillin G. This belongs to the cell wall inhibitors. This is given subcutaneously. This is one that can be lethal if given intravenously. The substance that this is derived from originally, bread mold. And what is peptidoglycan? Because this stops the production of peptidoglycan. This is what's going to enable the bacteria to survive against the body's immune system. If we destroy peptidoglycan, the bacteria cannot fight the host. Cefovecin, also called Convenia. This belongs to the class of antibiotics called cell wall inhibitors as well. This is given once every 14 days, and this is used for skin infections most commonly. The kinds of animals that should avoid this drug family are exotics. This will kill off their normal gut flora, like all cell wall inhibitors. Amoxicillin and clavulanic acid, also called Clavamox. This is going to be a cell wall inhibitor as well. A beta-lactam ring is what's going to interfere with the bacteria's cell wall synthesis. And beta-lactamase is what the bacteria makes. It's an enzyme that the bacteria makes in order to destroy the beta-lactam ring. So we potentiate the penicillin in order to make it stronger and prevent beta-lactamase from enacting on the beta-lactam ring. So we're outsmarting the smart bacteria. Bacitracin, neomycin, polymyxin, also called BNP. This is classes of antibiotics in this drug. Polymyxin is going to be a cell wall inhibitor. Bacitracin is a cell membrane inhibitor, and neomycin is a protein synthesis inhibitor. We use BNP in the eyes. We can use it in dogs and horses. We do not use this in cats. Cats can have a very bad reaction to BNP. If we use dexamethasone or hydrocortisone, these are steroids, and so the conditions that we would never add these to is eye injuries or ulcerations. We need a negative fluorescein test before we are able to place this into an eye that, with steroids. Gentamicin, this is going to be protein synthesis inhibitors. Side effects are going to include ototoxicity and nephrotoxicity. We use this in parenterally. We can also use this in eye drops and ear medications as well. And this was in that NPR story. They were using this to prevent infections when the chicken farm applied chicken vaccines inside the eggs of the chicks who have not hatched yet. Good story on NPR if you haven't heard it. Tetracycline, this is going to be a protein synthesis inhibitor, and we use it to treat rickettsial diseases that are caused by ticks. We can also use it for upper respiratory infections. They use this in shelters a lot, or for animals that have allergies to cell wall inhibitors. And what does it do to calcium? It's going to chelate or bind to calcium. What does it do to the teeth? When it chelates or binds to the calcium, especially in young animals that do not have their adult teeth in yet, it can cause enamel erosion or enamel defects. And then is this bactericidal or bacteriostatic? This is going to be bacteriostatic. So tetracycline, doxycycline are protein synthesis inhibitors, will fall under bacteriostatic, meaning that it stops the bacteria from reproducing but does not kill it off. The body's immune system will then take care of that. Doxycycline, this is a protein synthesis inhibitor. We use it to treat rickettsial diseases, kennel cough, things like that as well. It chelates to calcium again. It can cause enamel erosion or enamel defects in the teeth, especially when used in young animals before all their teeth are formed, or in, say, a pregnant dog. We could cause enamel issues in the puppies. Is it bactericidal or bacteriostatic? This is going to be a bacteriostatic drug. And what happens if the tablet or capsule gets stuck in the throat? We can have esophageal strictures. So how do we avoid that? We are going to follow the pills and capsules with 6 cc's of water by mouth. Chloramphenicol, this belongs to our protein synthesis inhibitors. It can cause aplastic anemia in humans, and it is illegal to use in food animals. The byproducts, the meat, cheese, milk, butter, things like that could cause humans to become very sick with aplastic anemia, which could be potentially fatal. Azithromycin or Zithromax or Z-Pak. This belongs to our protein synthesis inhibitors, and of that group, this belongs to our macrolides. This is used in penicillin-resistant infections or animals that have allergies to penicillin, and this is not for use in exotics. Hindgut fermenters, this can cause issues with killing off their normal gut flora. Clindamycin, also called antirobe, this belongs to the protein synthesis inhibitors as well. This is going to be part of the lincosamide branch of our protein synthesis inhibitors. Side effects are GI issues, and special about the bacteria that this treats, these are used for anaerobic bacteria, or bacteria that do not need oxygen in order to survive. Bacteria that might live in, say, for example, a cat bite wound that is very deep and doesn't have a lot of oxygen in those tissues. It is contraindicated in our exotics and our horses, the hindgut fermenters. This will kill off the normal gut flora, and why? It can cause clostridial enterotoxemia, or an overabundance of Clostridium. Sulfadiazine trimethoprim, or SMZ, or TMPS. This belongs to our antimetabolites. It can cause KCS in the eyes, keratoconjunctivitis sicca, or dry eye. Side effects include crystalluria, KCS, or skin rashes. All of these issues could be side effects from it. Potentiated means that it is combined with substances or salts to prevent the bacterial resistance. Now, these are good for issues like urinary tract infections because these get excreted through the kidneys. The antibiotic is still active even when it goes down through the kidneys and into the bladder. Enrofloxacin, also called Baytril. This belongs to our nucleic acid agents, and it belongs to the fluoroquinolone branch of our nucleic acid agents, and this can cause blindness in cats. It can also cause cartilage defects to young animals that are growing. It can cause problems with their cartilage. Metronidazole, also called Flagyl. This belongs to the nitroimiazoles, or the other group. And medical issues that it treats diarrhea, protozoal infections, bacterial infections, and inflammation. And it treats bacteria and protozoa as far as the microbes that it treats.